We've all been there. Your heart begins racing, sweat starts to pour from your head, along with other more noticeable areas of your body. Your mouth instantly dries up, as if you haven't had a drink of water in days. These are signs of anxiety and are most often completely normal. For people who push themselves outside of their comfort zone, anxiety is often the result. But here's the deal. Comfort zones, like most everything else in life, are individualized to each person. Some of us can hop up on stage in front of hundreds of people with as much ease as taking a bite of food. Others fall over with the mere thought of speaking in front of 10 people. For children with special needs, specifically autism, anxiety has the potential to take over their lives. As an example, my son's comfort zone is being at home. Just the thought of leaving that bubble often sends him into a meltdown, or at the very least, controls his emotions. What emotion, you ask? Fear. For people with anxiety disorders, the fear of what could happen paralyzes us. Irrational thoughts such as, what if I mess up? We then begin to play our scenario in our heads of us actually messing up. Or, what if they laugh at me? Then again, we play our own version of a home movie in our minds of people actually laughing at us. These mental games simply continue to build greater fear and more significant anxiety, which can become crippling. But what if that irrational fear begins to control our lives? You may actually have an anxiety disorder. Today, we discuss the 5 most common anxiety disorders and different ways to overcome these challenges so that you and your child can begin enjoying life again. Welcome to this episode of Special Education Decoded. First, let's define what an anxiety disorder is. According to WebMD, anxiety disorder is a group of mental illnesses that can cause constant and overwhelming anxiety and fear. Excessive anxiety can make you avoid work, school, family get-togethers, and other social situations that might trigger or worsen your symptoms. There are many different types of anxiety disorders. Today, we will cover the top 5, starting with number 1, generalized anxiety disorder. The National Institute of Mental Health, or NIMH, says that people with generalized anxiety disorder, or GAD, display excessive anxiety or worry most days for at least 6 months about a number of things such as personal health, work, social interactions, and everyday routine life circumstances. Symptoms of generalized anxiety disorder include feeling restless, wound up, or on edge, being easily fatigued, having difficulty concentrating, mind even going blank, becoming irritable, having muscle tension, difficulty controlling feelings of worry, having sleep problems such as difficulty falling or staying asleep, restlessness, or unsatisfying sleep. There are 2 main ways to overcome generalized anxiety disorder. They are cognitive behavioral therapy, CBT, which is a method used to teach people different ways of thinking, reacting, and behaving to situations that help them feel less anxious and worried. There's also medications. Your doctor can work with you to figure out a medication that would work best for your individual situation. Next, let's talk about number 2 on our list, obsessive compulsive disorder, or OCD. Now, according to the NIMH, OCD is a common, chronic, and long-lasting disorder in which a person has uncontrollable, recurring thoughts or obsessions and or behaviors, compulsions, that they feel the urge to repeat over and over. Common symptoms of OCD include fear of germs or contamination, unwanted, forbidden, or taboo thoughts involving things such as harm, aggressive thoughts towards others or yourself, having things symmetrical or in a perfect order, excessive cleaning and hand washing, repeatedly checking on things such as repeatedly checking to see if the door is locked or the oven is off, compulsive counting, spends at least 1 hour a day on these thoughts or behaviors. Now, treatment for OCD includes the same things as before, both cognitive behavioral therapy and medication. Next, let's discuss number 3 on our list, panic disorders. According to NIMH, people with panic disorders have recurrent unexpected panic attacks. These panic attacks are sudden periods of intense fear that come on quickly and reach their peak within minutes. Symptoms of panic disorders include heart palpitations, a pounding heartbeat, or an accelerated heart rate, almost as though you're having a heart attack. sweating, trembling, or shaking, sensations of shortness of breath, smothering, or choking, feelings of impending doom, feelings of out of control. Panic attacks can be intense, and they often lead to people avoiding situations that could trigger these attacks. This comes back to the definition of anxiety disorders: changing your life due to fear. Next on our list of anxiety disorders is number 4, post-traumatic stress disorder, or PTSD. Now, according to NIMH, post-traumatic stress disorder is a disorder that develops in some people who have experienced a shocking, scary, or dangerous event. It's estimated that about 15 to 30% of our military personnel suffer from PTSD once they return from active duty. Now, for children, symptoms of PTSD can include things such as wetting the bed after they've learned to use a toilet, forgetting how to or being unable to talk, acting out the scary events during playtime, or being unusually clingy with a parent or other adult. PTSD in children can be challenging to uncover since one of the symptoms is forgetting how to talk. The best course of action is to seek professional therapeutic assistance. A psychologist would be an example. Like the other disorders we have already discussed, another area of treatment is medication. Last on our list, and perhaps the most common for many children with special needs, is number 5, social phobia or social anxiety disorder. According to the U.S. Health and Human Services, social anxiety disorder is an anxiety disorder characterized by overwhelming anxiety and excessive self-consciousness in everyday social situations. Symptoms of social anxiety disorder tend to come out when presented with a social situation. They include sweating, trembling, chest pounding, or the feeling of your mind going blank. People with social anxiety disorder tend to feel nauseous or stick to their stomachs in social situations. They tend to show a rigid body posture, make little eye contact, or speak with an overly soft voice. People with social anxiety disorder may find it scary and difficult to be with other people, especially those they don't already know, and have a hard time talking to them even though they wish they could. They tend to be very self-conscious in front of other people and feel embarrassed and even awkward. Also, folks with this particular anxiety disorder are typically terrified that other people will judge them. So, they tend to stay away from places where there are other people. For children, there are a few ways to help them overcome these challenges. As I mentioned at the beginning of this video, our son shows many signs of social anxiety disorder. While the steps we have taken won't work for everyone, it has worked for him. First, we spend time preparing for the scenario. In the beginning, this process took a week. During the time of preparation, we talk about the upcoming activity in a fun, exciting way. We draw pictures about what we might see, again, using only positives. Utilize visuals of the place, including an actual picture if the outing is going to be at a specific restaurant or building. Now, once the outing begins, we use positive praise at all times during the excursion. We also use constant redirects. One thing our son does when he is overcome with anxiety in a public setting is he talks about when people around him are going to leave. We answer the question one time and then begin redirecting to other aspects of our outing, like what's he going to eat or what does he think of the table. Then we set a timer for him when we have a good idea of how much longer we'll be there. For my son, this step is critical. Lastly, we praise. Praise often. We've been following this process for the past few months, and it is working very well. So much so that our son asked to go to a restaurant just last week without prompting. He's also began talking about wanting to stay in a hotel and has planned family walks several nights over the past couple of weeks. None of this would have happened just a month or two ago. I've mentioned this a lot, but it's worth mentioning again. Consistency is critical. COVID-19 has really accelerated many anxiety-driven challenges within the special education community. Overcoming these obstacles will not be easy, but it can be done. The bottom line is that we all experience anxiety from time to time. There's no secret there. However, when you notice anxiety beginning to shift to a way of life for your child, immediate action needs to be taken. It's much easier to overcome something that's been going on for a couple of months than it is when it's been going on for a couple of years. If you have questions about anxiety disorders, please leave a comment below. You got this. Just be consistent and do not give up. From all of us at specialedresource.com, Thank you for watching this episode of Special Education Decoded. We'll catch you in the next video. Thank you for watching this video until the end. Please take a moment, give us a thumbs up. Your support means the world to us. If there's a specific topic you're interested in, please leave a comment. Until then, enjoy these other videos designed to help parents navigate the crazy world of special education. Thank you.